Today, we are jumping into one of the most hotly debated conditions in all of modern psychiatry, dissociative identity disorder, or DID. And it's a diagnosis that's caught in this really strange paradox. I mean, it's officially in the books, but it's also intensely questioned by the very experts who are supposed to be using it.
And that paradox, well, that's the big question we're tackling here. How can something that's listed in the official diagnostic manual, the psychiatric Bible, cause such a massive split in the professional community? We're going to unpack that whole conflict, and we'll look at it from both sides.
So here's our game plan. First up, we'll cover the official side of things, the clinical picture and the established treatment. Then, we're going to dive into the voices of skepticism to really understand the controversy. And we'll wrap it all up by looking at where this whole unsettled debate is sitting right now. Okay, let's get right to the heart of it. And you've got to understand, this is not just some minor academic disagreement. This is a fundamental, deep-seated split that has real-world consequences for patients, for therapists, and for how we even think about trauma and identity. The core tension really is just that simple. On one side, you have these incredibly comprehensive, detailed guidebooks on how to treat the disorder. But at the exact same time, you have a huge chunk of the psychiatric world questioning if it's even a distinct diagnosis at all. It's a fascinating and pretty wild situation. So to really get a handle on this debate, we have to start by understanding the case for DID. What is the official story? Let's take a look at how the formal guidelines actually define and explain this thing. And a major player here is the International Society for the Study of Trauma and Dissociation. You'll see it called the ISSD. These guys are a key authority, and they publish these super detailed guidelines that basically sum up all the current clinical knowledge on how to treat DID. So what exactly is DID, according to these guidelines? Well, it's described as a condition where one person experiences separate alternate identities, often called alters. Now, this is a really crucial point. The modern understanding isn't about having multiple people living in one body. It's about a single identity that has been fragmented or shattered into pieces. And how could that possibly happen? The leading theory is what's called the developmental trauma model. The idea basically is that DID is a creative, if tragic, survival strategy. Imagine a very young child facing trauma that's just too much to bear, with no safe adult to turn to for comfort. Their mind, in an effort to survive, can fracture. It walls off the unbearable memories and feelings just to keep going. And let's be crystal clear, we are not talking about a mild condition here. The level of distress is profound. Just look at this number. According to the ISSTD's own guidelines, a staggering 67% of patients with these disorders have tried to commit suicide more than once. That statistic alone tells you just how severe the suffering really is. Now here's something that's really interesting. Despite all the controversy we're talking about, there's actually a highly structured, internationally recognized approach for treating this. This isn't therapists just winging it. It's a methodical, step-by-step process. And that treatment process is broken down into 3 distinct phases. You start with the absolute basics, safety and stability. Because, you can't do the deep, hard work on trauma if your life is in chaos. Only when that foundation is solid do you move on to carefully processing those traumatic memories. And then, the final phase is all about integration, bringing the pieces together and learning to live a unified life. And that really is the ultimate goal here, integration. It's this long-term process of trying to undo that fragmentation, to bring all those divided parts of the self back together. The final goal, for some, is something called final fusion, which is the point where the person truly achieves a single, unified sense of who they are. Okay, so that's the official clinical picture, a severe disorder born from trauma with a very structured plan for healing. But now we have to flip the coin and look at the other side of this story. Why are so many experts so deeply skeptical? And this timeline right here perfectly illustrates a piece of the puzzle for skeptics. I mean, look at how much the diagnosis itself has changed. It first showed up as multiple personality disorder in 1980. Then, in 94, the name changed to Dissociative Identity Disorder, which was a huge conceptual shift. This constant evolution makes some experts wonder just how stable and well-defined the whole concept really is. And here's another huge point of contention: symptom overlap. A lot of skeptics look at the features of DID, things like identity confusion and a history of trauma, and they say, hang on a second, This looks an awful lot like a really severe form of borderline personality disorder, or maybe complex PTSD. Their argument is that the lines are just way too blurry to definitively call it a separate disorder. And that's really just the tip of the iceberg. The skepticism is fueled by a lot of things. There's a relative lack of large-scale, hard scientific research compared to other mental health conditions. It has this really unfortunate historical baggage from being tied up with the so-called satanic panic of the 90s, which really hurt its credibility. And today you've got this explosion of sensationalized portrayals on social media, which many clinicians feel completely misrepresents the real condition. This quote from a psychiatrist really captures that clinical skepticism perfectly. The argument goes something like this. Maybe what's being labeled as a distinct alter isn't a separate identity at all. Maybe it's just a better way to describe how someone with severe trauma learns to compartmentalize parts of themselves. We all have different sides to our personality, right? The idea here is that in the context of extreme trauma, those sides just become much more walled off from each other. Okay, so we've looked at two very, very different stories here. On one hand, a well-defined clinical disorder that comes from trauma. On the other, a highly controversial diagnosis that's questioned by many in the field. So where in the world does that leave us? Let's try to pull it all together. And this chart really just sums up the standoff. The clinical view says, yes, DID is a valid diagnosis, it comes from trauma, and here's the treatment path. The skeptical view says, well, it might just be a variant of BPD or PTSD, and it raises a serious concern that focusing on alters in therapy could be iatrogenic. That means the therapy itself might accidentally encourage or even create the very symptoms it's supposed to be treating. But here's the bottom line. For all the arguments, for all the back and forth, for all the skepticism, dissociative identity disorder is still an official diagnosis in the DSM-5. It hasn't been removed. The American Psychiatric Association officially recognizes it as a real condition that requires treatment. That's the crucial takeaway. But if there's one single thing that both sides of this incredibly heated debate can absolutely agree on, it's this. Whether you're a proponent or a skeptic, everybody acknowledges that we desperately need more and better scientific research to truly understand what's going on with severe dissociation and trauma. Which leaves us right back where we started, with this huge, unsettling question. What is DID, really? Is it a unique, distinct disorder? Is it just a very severe expression of a known trauma response? Or is it a cultural phenomenon? A way that our society has learned to express profound and unbearable distress. As of right now, the jury is still very much out, and this diagnosis remains on trial.